Peripheral arterial disease, PAD, is a prevalent but often underdiagnosed condition characterized by a narrowing or blockage of the arteries that supply blood to the extremities, most commonly the legs. It is primarily caused by atherosclerosis, a buildup of plaque within the arteries. This plaque is composed of cholesterol, fat, calcium, and other substances found in the blood. As the plaque accumulates, it narrows the arteries, restricting blood flow to the limbs. The hallmark symptom of PAD is intermittent claudication, which is pain, cramping, or weakness in the legs that occurs during physical activity, such as walking, and typically subsides with rest. This occurs because the muscles in the legs are not receiving an adequate supply of oxygen-rich blood during exertion due to the narrowed arteries. As the disease progresses, symptoms may worsen, and pain may even occur at rest. Other symptoms of PAD include numbness or weakness in the legs, coldness in the lower extremities, changes in skin color or texture, and slow-healing wounds or ulcers on the feet or legs. PAD is a significant risk factor for other cardiovascular events, such as heart attack and stroke. Individuals with PAD have an increased risk of developing coronary artery disease, CAD, and cerebrovascular disease due to the systemic nature of atherosclerosis. Diagnosing and managing PAD is crucial not only for improving the quality of life for affected individuals but also for reducing the risk of potentially life-threatening complications. Several factors increase the risk of developing PAD. Smoking is the most significant modifiable risk factor for PAD. It accelerates the progression of atherosclerosis and damages the blood vessels, leading to increased plaque buildup and narrowing of the arteries. Individuals with diabetes are at a higher risk of developing PAD due to the damaging effects of high blood sugar levels on the blood vessels. Hypertension can damage the arteries and accelerate the development of atherosclerosis. Elevated levels of cholesterol, particularly low-density lipoprotein, LDL, cholesterol, contribute to the formation of plaque in the arteries. PAD becomes more common with advancing age, with individuals over 50 years old being at higher risk. A family history of PAD, cardiovascular disease, or stroke increases an individual's risk. Being overweight or obese increases the risk of developing PAD, as excess weight puts additional strain on the cardiovascular system and can exacerbate other risk factors such as diabetes and hypertension. Diagnosis of PAD typically involves a combination of medical history, physical examination, and specialized tests. The ankle brachial index, ABI, is a non-invasive test commonly used to diagnose PAD. It compares the blood pressure in the ankle with the blood pressure in the arm to assess the extent of arterial blockage. Other tests such as Doppler ultrasound, magnetic resonance angiography, MRA, computed tomography angiography, CTA, and angiography may also be performed to evaluate the location and severity of arterial narrowing. Treatment of PAD aims to relieve symptoms, improve quality of life, and reduce the risk of complications. Lifestyle modifications are often recommended as the first line of treatment and may include smoking cessation, regular exercise, a healthy diet low in saturated fats and cholesterol, and management of underlying conditions such as diabetes and hypertension. Medications such as antiplatelet agents, e.g., aspirin, statins, and medications to control blood pressure and blood sugar levels may be prescribed to reduce the risk of cardiovascular events and slow the progression of atherosclerosis. In cases where symptoms are severe or lifestyle changes and medications are insufficient, invasive procedures such as angioplasty and stenting or surgical bypass grafting may be necessary to restore blood flow to the affected limbs. These interventions aim to widen or bypass the blocked arteries to improve circulation. Peripheral arterial disease is a common vascular condition characterized by narrowed or blocked arteries in the extremities, most commonly the legs. It can lead to significant morbidity and mortality if left untreated, making early diagnosis and intervention essential. By addressing risk factors and implementing appropriate treatment strategies, individuals with PAD can improve their symptoms, reduce the risk of complications, and enhance their overall quality of life.